Hey everyone, welcome to All About Dental Materials. I am Dr. Shagufa Khan, your host, and this podcast is about diving into real world dental cases with experts from the field. So, dentistry is evolving very fast, and one of the biggest challenges for the younger dentists and students is exposure, especially to the latest materials and techniques. In colleges, you might not get the chance to use or even learn about some of these materials, especially during your BDS. In each episode, we'll break down the cases via clinical pictures and discuss what materials were used and why. If you have ever scrolled through Instagram and seen a case and wondered what went on behind the scene and what materials were used and why did they choose that technique, then you are at the right place. So, if you're a dentist or a dental student who's curious to learn and discover newer dental products, this podcast is for you. Welcome back to All About Dental Materials. Today we have Dr. Mubaris with us, who's known for his work in biomimetic dentistry. Hi, Doctor. Thank you for being here.
Thanks. Hey, thank you for having me, Dr. Shagufa.
Before we start, can you please tell us a little bit about yourself, Doctor?
Myself, graduated from College of Dental Science, Davangere. Back in 2019, I've completed my BDS. Then was working under Dr. Shahul Amit, who is my mentor cum partner right now. So I've been working like about 5 years. Right now we have multiple clinics.
Okay.
Here I am. Yeah.
Okay, Doctor. So I follow you on your Instagram, and there were cases which I've seen, which I wanted to discuss with you. So this is the first case here. This is a case of direct composite restoration. And can you please tell us what this product is that you have used in this case?
Okay. This is nothing but a polyethylene fiber. So the particular
Mhm.
material I used in this case was from Kitsidnell.
Okay.
I was supposed to use the gold standard one like ribbon fiber, which was not available with me that time. Right now I'm using it. So these are
Okay.
polyethylene fibers which are different from the normal composites. We use these fibers just to reinforce the structurally compromised tooths, especially endodontically treated tooth or large amalgam restorations and all. So it helps to bridging the cracks of the pulpal floor. So what happens here is like these fibers are multi-directionally interlocked. So
Okay.
when there is force in multi-direction, it can be resisted when we use these sort of things. Yeah, and
So
also these materials prevent the shrinkage, polymerization, of course. So in such cases, there will be micro gaps between the composite and the tooth. So this can be prevented when we use these ribbon fibers and all. Yeah.
this is something we only use particularly with composite, is it? Or is it used even with GICs and
No, not at all. So
none?
basically, we use with there are some resins which we use when we use the ribbons and also to wet the ribbon or wet the fibers that we call
Okay.
JC and all that. Yeah.
Okay. So this is something we need to use in cases which is a bit compromised and or larger fillings or endodontically treated teeth, you're saying.
Yeah.
Okay. So in an endodontically treated tooth, would you still go for a crown once you use something like this, or you can?
Preferably, I'll go for. It depends upon the remaining structure what is present on the tooth actually.
Okay.
If it
Okay.
proximal and buccolingual walls like a thickness of 2 mm and all, we can go for a direct restoration, of course. So the material of choice depends upon the clinician, and there are a lot of materials available right now in market.
Okay.
When the tooth is a little bit compromised, I used to go for like what I suggest them is like go for indirect restoration rather than a direct the traditional crowns and all, which are not as good as the when we do a traditional crown, what we do is like we remove the excess, the remaining enamel also. So what
Yes. Yes.
happens
Yes.
is like the tooth become more brittle or more weak. So I don't prefer crowns nowadays. Yeah.
Okay. So this product is also, it has multiple uses, right? In we use it in fillings, but is it also used as retainers?
And use in perio cases, we can use it as a splint, and for bridges, like for creating bridges and all, so we can use, yeah.
So, doctor, like for somebody who's not using it now, they want to incorporate this in their practice. Now, how do you communicate this with the patient? Because patients are aware of what fillings are and what crowns are. To tell them that something new we're going to use in their fillings, how do you tell them?
Okay, what I basically do is like I show them the previous photographs which I have taken from various patients.
Mm.
I used to tell them the importance of the remaining tooth structures, the enamel, what is
Mm.
the, so I'll make sure that most of the tooth structure, once it is gone, it's very difficult to retain the tooth and all. So I used to show them through the photographs and make them convince. Yeah.
Okay. So basically, this is used to in order to avoid fractures or to gain more strength for the tooth, right?
Yeah. And
Yeah.
also shrinkage also reduces the polymerization.
For to avoid the polymerization shrinkage of the composite. Okay, thank you so much. Now, moving on to the next case. This is a case of composite restoration, and I can see that you have used a stain to make the tooth look natural. Can you please tell us which this product is and why do you think this is important?
Okay, this is a stain from Ivoclar basically. It is
Mm.
IPS Empress Direct. The color is like brown only. So why I use this, like I'm more passionate towards the posterior restoration and all. So to
Mm.
mimic the tooth from adjacent tooth and all, that's what I meant to use. And why I use is like this is a case referred from a fellow dentist actually, and the
Okay.
patient is very curious about the outcomes and all. So
Mm.
when we take the photographs, post-operative photographs, if I stained, I mimic the restoration and all, it'll be really good, right? So apart from the functional part, there is nothing, like it is not at all an important when it comes to
Mm.
functional. For aesthetic purpose, it is really good. Yeah,
Okay. So, which brands can we use for this
you can go
staining?
for the Ivoclar IPS Emberex, which is cost around 2K for
Mhm.
1 gram syringe. It's basically a flowable consistency only, like
Okay.
your normal flowable composite. And also in market you'll get it from Tokiyama, Shofu, and
Okay.
Coscoltin also, but they are a little bit costly, I guess. Yeah,
Okay. Okay. So, this particular one is Ivoclar, right?
yeah.
Yeah. So you get different shades in that as well, or is it like one shade,
No,
one
no, no.
universal shade?
There are multiple shades like brown, ochre, white. Difference. You can mimic the even the micro cracks and all within the inner
Okay.
cusp and all. You can mimic with this. Yeah, this is really.
Okay. Okay, that's interesting. Um, so is this product is used before polishing or after polishing, or when is it used exactly?
Is used before polishing only as a final layer.
Of
You
composite.
can take a pinch and put it on the grooves. Then, using your fissura instrument, you can carve
Mm.
through along the grooves and cups in between the cusp and all, and then cure as a final one. Or else you can use it when we do the dentine layering. No, you can
Okay.
carve with this one, and over that you can do the cuspal building also. But it should be just before the polishing, after the
Um,
final cure. Yeah.
got it. Got it. Thank you so much. So now moving on to the third and the last case. This is a case of post-endodontic restoration of a maxillary molar with direct composite. So this is the image, and I'm really curious to know what is this product that you have used here.
So this is a fiber reinforced composite from
Okay.
named Everex Posterior. These are short fiber reinforced one, whereas the ribbon fiber is a polyethylene fibers. The difference is like this is glass fiber. So
Mm-hmm.
why we use is like for preventing and stopping the propagation of the fracture on the restorations. So this we use as a substitute for dentine replacement. And over that, the final layer we use the normal universal composites here.
Oh, after using this, you're supposed to use the final layer as composites again.
Yeah.
Oh, okay. So how, when you compare it to the traditional composites that we use in our clinics, how much more does this one cost?
It costs around like 4.5K, depends upon the market and all,
Mm.
but a bit costly even though. But right now there is no competing product for this. Again, this like there is one from Dendaprag. It named as Fibrafil Cube or something. It
Okay.
comes in a cube. The composite comes in a very small cube, but it's really costly compared to GC. Yeah.
So this one is particularly only used for posterior restorations, is it?
You can use in anterior also in compromised tooth. Basically, this is used as a dentine replacement, dentine substitute.
Okay, got it, got it. Thank you so much. Um, so I just have one more last question for you. What do you think somebody who just finishes their BDS should be doing? Somebody who does not want to do an MDS, what should be they doing after they finish their BDS for the next few years?
Okay, it depends only upon their interest and passion toward dentistry. Yeah, of course. So they have to find the field in which they are more interested. They have to enhance their skill. They have to go for workshops. They have to attend the CDs, classes, and all. They have to brush up their skills. They have to do the most advanced procedures also. You just can't sit back and do the traditional things and um, get a nice revenue. It's very difficult nowadays.
Mhm.
So ultimately, there are many choices in dentistry. You can either go for a start up a clinic and do like an entrepreneur,
Mhm.
or you can do a nice practice. Of course, there are a lot of options for general dentist also. Yeah.
Okay. So now, how did you learn about these products? Because we are not taught about this in college, right? Like these products we don't use in college. We're not even seeing these products in college. So where exactly did you learn about all this?
I used to attend as much as webinars and CD programs, workshops, and all. And
Okay.
apart from that, if there was any online sessions conducted by renowned doctors and all, I used to attend that, and I do the trials and all in my clinics in dummies and all, do the
Mhm.
carvings. So that's how trial and error. Yeah, of course.
Okay, okay. Okay, doctor. Thank you so much for your time and expertise. It was really nice talking to you.
Thank you, Dr. Shaguf, and my pleasure to share my experience with your audience. Yeah.